All right, this really is something interesting that you point out. We covered this particular article from Professor Ioannidis on our show back in the beginning to mid-March when he said nursing homes is where our focus needs to be because this is where vulnerable populations are. And the medical field knows that other types of coronaviruses have decimated nursing homes in the past. Why was this ignored?
Well, there are a number of reasons, but the most important is that COVID is not the flu. And most of the epidemiologists, public health authorities, they were trained, they cut their teeth on influenza pandemics. And so in influenza, it does affect children, it does affect the young. And so they thought, well, that's what we got to do. We got to close the schools, we got to shut down the economy, because that's what you might do if you had a 1918 style flu pandemic. But COVID-19 is a very different disease, and it appears to affect mainly the elderly, mainly people in nursing homes.
So you pointed out correctly, by the way, in your article, you're one of the only people who have written this in a mainstream media publication, that Florida Governor Ron DeSantis has handled this correctly when it comes to the elderly population in his state, especially compared to New York Governor Andrew Cuomo. Can you expound on that for us?
Yeah, so as you cited in your opening statement, Cuomo forced nursing homes to accept patients who were infected with COVID-19 who were coming out of the hospitals because he was afraid, because he was told by his experts, well, we're going to be like Italy. Our hospitals are going to get overrun. And so the thing we have to do is kick out all the people who don't need to be in the hospital, even if the nursing homes go down in flames. DeSantis, on the other hand, looked at the actual data. He resisted enormous media pressure, as you know, to do things the opposite way. But he looked at the data. He saw what was happening in China. He saw what was happening in Europe. And he said, no, what? You know what? The real thing we have to do is we have to protect nursing homes, because if we don't, those are the people who are going to end up in hospitals, in ICUs. So if we protect nursing homes, we'll protect hospitals and ICUs as well. And that central insight is what's made all the difference in the Florida results versus the New York results.